Hello, welcome to today's episode. I'm Naswango. I'm a nurse midwife and a yoga trainer. So, today I want us to talk about the importance of breathing. Who needs to breathe? Why breathe in pregnancy? So, as a nurse, I'll just highlight a few things. Oxygen is important for your body, and when you're pregnant, your lungs are compressed by your baby. So, you need to intentionally add more oxygen. Your body is producing a lot of carbon dioxide, which may hang around your body and you end up feeling tired, sometimes having difficulties in breathing, and the list goes on. Because once your baby comes into your tummy, it occupies space, and one of the spaces it presses on is your lungs. So, this technique, you intentionally do deep breathing, it soothes you, relaxes you, and the baby becomes happy too because you are the one supplying oxygen to your baby through your placenta. So, as you perform this intentional deep abdominal breathing, your baby may actually even kick, play inside you. So, it's a good thing once you feel your baby kick because sometimes you should know your baby is okay. I teach this technique especially to mothers who are a bit anxious about the baby. Is the baby okay? Maybe a mother who has also had a previous miscarriage or a baby died before it was born. I remind them a few tips like this important one. Your baby should play every 4 hours. You should feel a movement, at least a movement, telling you all is well. So, in case your baby is not playing, you can take a sip of water, eat some food, or just do deep breathing. Yeah, oxygen is vital. And once your baby senses you have enough oxygen, it also kicks, it becomes happy. So let's get started. Who should do deep breathing? All pregnant mothers should actually do deep breathing. Let's start. Um, Early pregnancy, second trimester, or third, you should learn this early so that you're able to supply your body with enough oxygen. From the second trimester, that's when you start now feeling the effects of your pregnancy, from feeling exhausted, or your baby is now pressing on your lungs, you're having a bit of difficulty in breathing, maybe even worse in case you've had what is called asthma or another conditions of the lungs or heart disease, and now you're pregnant. The intensity of the difficulty in breathing becomes more. You may feel breathless. So this is also for you. The beauty of deep breathing is it can be done by everyone, from high risk pregnancies to a previous scar or any other condition, because it's gentle yet very, very effective. So let's learn a few more things. What about CS moms? As your scar expands, because you may feel the effects of pregnancy on your scar. Remember, it's okay. Your body is reminding you that there's a stretch somewhere. But I always recommend always keep communicating with your healthcare provider. This could be your midwife, your doctor, your gynecologist, your reproductive health specialist, so that you know of all is well. Because when you have a scar, sometimes you may get a few complications. So now let's get started. How do you deep breathe? As a pregnant mom, your belly is growing and you may feel the effects of pregnancy now on your lungs because your baby presses on your lungs. So you need to be more conscious of this fact. So this is how you do it. You sit comfortably first. I'm comfortable sitting like this. Many mothers also learn this pregnancy technique because it's very good for your hips. It's a hip opener, the way I'm seated, but you don't have to sit this way. You can be seated in a chair, but make sure your shoulders are relaxed. You're not tense, and come to the present moment. So this is how it looks like. First, your posture. Second, you do your deep breathing right here from the lower abdomen where you have your navel. You intentionally tuck your stomach in, tuck it in as much as you can, then gently release. When you're pregnant, you don't force more air than you can handle. Your lungs will cope with time. So, for instance, if you're a beginner, you can do just a few seconds, for example, three of them, like 1, 2, 3. Then gently release. 1, 2, 3. Inhale. 1, 2, 3. Let it out. 1, 2, 3. As you go on with time, you may do even more seconds, for example. This is a deeper breath at 5 counts. 1, 2, 3, 4, and 5. Release. 1, 2, 3, 4, 5. It's not recommended that you train your breath in pregnancy. It's always good to play safe so that you're not applying any pressure on your uterus. We don't want to hold breath when you're pregnant. Good. So when can you use this breathing technique when you're pregnant? If you're a CS mom throughout your pregnancy, and when they're performing any uncomfortable procedure on you, the breathing techniques help soothe you. They help keep you relaxed, help keep you calm. Or you're a normal, expecting a normal delivery, use these techniques a lot when going through labor, or when the doctor or nurse midwife is doing any procedure on you that is uncomfortable. You also use it just to energize yourself. Yes, it's a good source of energy, oxygen itself. So on a tired day, you don't have time for anything else, just sit down, put a timer on, give about give yourself about 5 minutes of deep breathing. You'll feel refreshed. Or if you need to take a nap, some others have issues taking a nap, just lie in your bed, lay on one side, and intentionally breathe in and out, slowly and intentionally. One more thing you can do with breathing is the CS moms. As you have your baby, there are many things you may not do. So many exercises are prohibited when you have had a cesarean section, a birth through surgery. So after birth, you can walk, you can hold your baby. That's the heaviest weight you can lift, but you can also do deep breathing. Yeah, that's allowed. It's very soothing, very calming with all the challenges happening after your birth. So learn these tricks and apply them. One last time, let's do a deep breath. Breathe in from here, your tummy. Intentionally and slowly tuck your stomach in as much as possible. Gently release. Start with about 3 seconds, build on to 5, next time to 10. Continue until you reach your maximum and keep that habit. So I'm Naswango. Please like, share, subscribe to this channel, and see you in the next video. Stay healthy.